So I want to be respectful of everybody's time. So thank you so much for joining us this morning. You are at the SafetyNet Assistance Network meeting, and if you're in the wrong meeting, I hope you will stay with us and get to know some people. If I could ask everyone to stop for just a few seconds and make sure you are muted. We've heard some great phone conversations over the years, or so that we've been doing this remotely. So everybody just check that, please. We're just so excited to have all of you here, and we so appreciate all you do in the community. So thank you so much. I'm gonna get started. We've got some great speakers today and some great announcements about things going on in the community that'll be really important for all of you to know about. And we will send this PowerPoint and all of the announcement slides out to you next week. And a reminder that if you have an event and you want to get it out to the community, you can also sign up for the bulletin feature in Charity Tracker, and we can make sure we get that out. Jan, I'm sorry you can't hear. Could everybody hear me? Is anybody not able to hear? Everybody good? Put it in the chat if you can't. All right, so we're going to start off with Sonia Donnelly, who is the Associate Director of Programs for Palmetto Project. I've known Sonia for a long time, and Palmetto Project, if you do not know them, you need to know them. They have amazing services in the community, and Sonia's going to tell you about them. So Sonia, I'm going to turn it over to you.
Thank you.
Everybody please mute, because I am still hearing voices. Thank you.
Thank you, everybody. Let me know if you have any questions, or you can put them in the chat. I'm happy to answer them offline afterwards. I am the Associate Director of Programs for Palmetto Project. And Palmetto Project, you may have noticed, is on the first floor of the Trident United Way building. We've been there for quite a while, and we're going to stay for quite a while, I hope. We are statewide, and we cover a variety of different programs. So on the next slide, you'll see a bunch of the different things that we focus on. We're probably most well known for the I voted sticker that you've seen, like the little Palmetto Project at the bottom of it, and wondered, who are they? What do they do? And we have been really involved in civic engagement and encouraging people to vote for decades. And so that's one of our signature little programs. And so we raise money to try to print the stickers, and then we go in the hole printing stickers for millions of people across the state. We also manage statewide the Dolly Parton's Imagination Library. So we raise the money to get the books and mail the books to people for kids under the age of 5. So they get a book every month. It's only available in certain zip codes. And that's just because we have only a certain amount of funding for different counties, different states. And the goal is obviously to get it statewide so that everybody, all children under the age of 5, can get free books through the mail and build a really robust library at home. Families Helping Families is our Christmas toys and elderly senior program that is based out of the Midlands. So we do not have it in the Low Country anymore. You may have heard of it from eons past, but we don't have it in the Low Country. We just have it in the Midlands area at this point. What I really want to focus on today is our health and access to healthcare programs, which are a huge part of what we're doing these days. So we have some vaccine outreach, Medicaid outreach, Medicare outreach. So I'll go over those in a little bit more detail. No, thank you. This is our team. So our team is We are in a hybrid work model at this point. So we work some days out of the office and we work a lot of time in different sites. So we'll be at East Cooper Community Outreach. We're at a clinic out in Georgetown. We're at the Hope Center downtown. So there's a lot of different places that we'll go if you need us to set up a day to help people with their health insurance and health coverage. We can do that. We set up a nonprofit health insurance agency about 3 or 4 years ago because we have been doing Medicaid outreach for decades, and we have been doing marketplace coverage since Obamacare came out. I always say you can call it what you want, Obamacare, Trump care, Biden care. I don't care so long as you guys get to the doctors and we're able to get the coverage that you need, because we want people to be able to access care, affordable care, quality care. Okay. So these are the types of things that we can help look at. We can do very simple cases all the way to complex. And we really do specialize in those more complex cases. I know a lot of people on the call already do a lot of these things. And great, because the more of us are doing it, the better it is. However, if you're having problems with the Medicaid in terms of you don't know why this person isn't covered, they should be covered, you don't know whether they're really eligible, they might be eligible, you're not really sure, then we're that place that you can call as well as a resource. So we can either help you kind of answer some questions insofar as what types of things might be qualifying for your consumer. We can take it, you can just refer it over to us and we will just take care of it. And so it's not that we have an inside track to Medicaid and we can needle this extra high person to get stuff covered, but we can in certain circumstances if it's been a really long time. But we don't just do that for everyone and anyone. However, our staff is trained to be authorized representatives. We will call Medicaid, we'll figure out what exactly it is that's missing, what's going on, what is the piece of paper that they're needing, that they've sent requests for. Have they sent a request? Why haven't we received it? Why hasn't the consumer received it? So if you're having any issues with Medicaid, let us know. We help with Medicaid in terms of PEFRA Medicaid for kids with special needs and disabilities, developmental delays. We also help with Medicaid for community long-term care waivers, Medicare savings programs, age blind and disabled, pregnant women, Partners for Healthy Children. So any type of Medicaid, if you have questions, because the forms all change depending on the type of Medicaid you need, let us know. We can help you with the screening process. We can help you figure out what paperwork you need. If it becomes too overwhelming, we can take over that process for you. Okay. The Medicaid renewal letters slide that you're seeing right now, this is the, if you can go back, thanks. This is the Medicaid renewal letters that should be going out at some point. Medicaid unwinding, if you've not heard of that term, is when the public emergency goes away for COVID-19, then Medicaid is mandated to update all of their Medicaid recipients. Right now, they haven't been turning people off the books since COVID began, which means there are people on the books who aren't eligible for Medicaid anymore, shouldn't be on Medicaid, their income is too high, they're too old, they have moved out of state, all of these things. So Medicaid is doing, has a renewed effort to update all the information. The most important and the easiest way to do it is to update the mailing address. And there's a website at the bottom of this slide where they now have an online way to do it. So the consumer can call in or they can send a form in, but it's not really that likely to happen. So if we can help people with filling out this form online, we can do it on their behalf. They can do it on their own. But of course, some people need a little bit more assistance. So the three things that they're really trying to focus on are updating the addresses, people checking their mail, and then people actually returning the forms that they're sent. The renewal process keeps getting pushed back. It was supposed to be this spring. Now it's extended till October, definitely probably going to be pushed out to the spring. So we don't know yet. We're kind of in limbo. where we keep updating people and then we'll have to call them again to update their information again. So just make sure if you have Medicaid consumers that are calling you or you know them, to just make sure that if they've moved recently, even in the past 3 years, that the Medicaid office knows where they are. Okay. Next slide. This is a partnership that we're in with the South Carolina Appleseed Legal Justice Center. If you've not seen them, they send out some really incredible emails, e-blasts, and e-newsletters, and they do some great advocacy work. So their work on the Medicaid side is really about how important Medicaid is for access to healthcare, and that it's quality healthcare. People don't have to be worried about getting on it. It's not just like janky healthcare that you can, that doesn't really cover anything, that it is robust. It covers a lot of different things. Their goal is always to say, let's keep propping up Medicaid. Let's not refuse to get money for Medicaid, but also that they are in favor of Medicaid expansion. And that means we would cover this gap of 200,000 people who don't have coverage. They're not eligible for Medicaid, not eligible for marketplace coverage. So they are collecting stories. They're doing a story banking program where they talk to people who are on Medicaid, struggling to get Medicaid, have applied and just haven't heard back from Medicaid. So if you know someone who is in that situation, they would like for them to share their healthcare story with them. And it could be as simple as an email story, over the phone, a video with a picture like this lady, Patricia Glover. And they are also incentivizing it with a $25 gift card. So it's not bad. I like gift cards. So if you think your consumers could use that, definitely let them know about that. If you want someone more information about that program, let me know, because I can send you the referral form as well. All right, so moving on to Medicare. So of course, Medicaid is usually for low-income families, children, age blind, disabled with low income, low assets. Medicare is usually for seniors over 65. So not just on Social Security retirement, but they have to be over 65, or people who have been on disability for more than 2 years. Okay, that's usually who fits in that Medicare realm. And I know people get Medicaid and Medicare mixed up. We are coming up to annual enrollment and open enrollment for most insurance. Employer insurance often is at the end of the year. Medicare is right now, and then I'll talk about Affordable Care Act health insurance in a minute. But the Medicare open enrollment starts October 15th. We can start talking to people about their Medicare plans October 1st. And so if you have people who are confused about what Medicare is, or they don't know what plan they're on, they don't know if the plan they're on is the best plan, you need to find out what plan they're on. You don't know what they've got. If you need just help looking up that stuff, we're absolutely happy to help with that too. So we help answer questions about Medicare. We can come in and do a Medicare 101, 201 session if you need for your staff or your consumers. We often will get referrals from people who maybe you think that they should have some sort of assistance, prescription assistance with extra help, or Medicare savings program that helps with that Part B premium of $170 that comes off the top of their Social Security checks. If you have any questions like that, please don't hesitate to call us. We will answer questions about A, B, C, D, and E. If you don't know what those are, I am happy to help do a session, send you some information so that you guys can learn about those things. We can help people enroll in supplement plans, prescription plans, Medicare Advantage plans. When is it best to not get any plan? Which plan is going to be the best? A lot of times we're looking at which plans are going to have the best coverage for doctors, hospitals, prescriptions. That's the biggest thing. We are licensed insurance agents, so we are commissioned. However, because it's a nonprofit social impact model, I don't get that commission myself. The commission goes back into the program, it supports the program, and it supports the other programs that we do that we don't have money for. Like, we don't really get a lot of money to do all the complex cases. So A lot of what we do is we just try to look at what is the best for the consumer. Our goal is not to make money. You know, I'm not in this game, and I don't think any of us are in this game to make money. Our goal is to really help the consumer figure out what plan is going to get them the coverage that they need. And we're trying to get them the best bang for their buck, but also not to be taken unawares. When you're eligible for Medicare, and probably some of you are, people get inundated with calls, emails, texts. They put their number into one wrong website and they get flooded with people calling them. And the thing that I'm almost always most afraid of is when seniors give out their Social Security numbers, they give out their Medicare numbers over the phone, and then they get signed up for something that they didn't realize they were getting signed up for. And we get so many calls from people who are just tearful and worried and scared that they did something wrong and they don't know how to fix it. So our goal always is to reach as many people, just to reassure them that whatever they did was the right thing, to reassure them that the information that they have is the right information. But also if they need help with that enrollment piece, we can help them do that too. We often will help people transition from one type of insurance to another. So if people are transitioning from Medicaid, Marketplace, employer insurance to Medicare, it can be a difficult process or difficult to understand process. So we help them understand exactly what it is that is happening and exactly how it works. That way they have enough information, they're confident in the decisions that they're making. Okay, so October 15th, December 7th. December 7th is a hard deadline. Okay, next slide. All right, so moving on. Blah, 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 blah. Pretend you didn't hear about Medicaid and Medicare just yet. This is marketplace health coverage. So again, that Obamacare, Trump care, Biden care, whatever care you want to call it. This is for people who do not have Medicaid, they don't have Medicare, they don't have employer-sponsored insurance. They need some form of health insurance, okay? If they need health insurance right now, we can still help them sign up before October 1st, or for November 1st, or for December 1st. This particular open enrollment period is for people who miss whatever deadline it is, or they are coming off insurance, or they already have marketplace coverage, and they need to look at what the plans look like for next year. So for people to have their coverage start with no gap in coverage, they need to sign up by December 15th, and November 1st is when we can start signing up everybody else and looking at plans. We have, I think, 3 or 4 new marketplace carriers this year. We have Cigna coming into the market. I think it's, I don't want to say, I know we have Bright, Molina, Ambetter, Blue Cross Blue Shield, and we have like a couple more that we don't know yet. And it's coming up on mid-September and we still don't know who these carriers are. The most difficult thing about when new carriers come in is that they change the prices because they become more competitive, but what it does is it hikes everybody's prices up, unfortunately. But what it also does after a couple of years is it gets a bit more competitive and then the prices should level out again. So we are a little bit worried about what the prices are going to look like. We don't know. It's a bit of a crapshoot until November 1st when we get to see the plans. But we are trained. We are going through training right now. Usually the marketplace plans come out in October, and then we just spend the whole month trying to figure out, while we're signing up people for Medicare, we're just really doing our research and our education to make sure we know all the plans. So if you have anyone who needs coverage or is looking for marketplace coverage, definitely get them to give us a call. We're happy to help them. We're happy to walk them through the process. It's real low pressure. We're not salespeople. If you don't have health coverage, there's no skin off my nose. I want you to have it, but I'm not going to force people to get it. Our goal is really to educate people and make sure they know what's out there. So then if they decide that that's not the path they want to go in, so long as they have all the information, we'll feel good with that. Okay. We also help people with different resources. So if there's community resources, if they don't qualify for any of these programs, then we're going to be looking at the federally qualified health clinics. We're looking at the free clinics. We partner with a lot of those folks to make sure that they at the very least are going to be accessing preventative care and potentially specialty care, depending on what their services are. Okay. Next slide. Okay, so this is one of our other programs. We have funding from the CDC and Dhec to do vaccine equity and access. So we are doing some COVID-19 outreach, which, you know, has changed from the beginning of COVID to now. It's a little bit less scary. People aren't necessarily looking at COVID-19 as much, but it is trying to get it into the normal routine of vaccinations, like get your flu vaccine, get your COVID vaccine, trying to normalize it so that people do feel comfortable getting boosters and things like that. These are just some of our materials and giveaways, and I want to let you know that we have these things because I'm happy to have someone bring some of these materials to you. Where right now we have community toolkits, we have, we have binders, and then we have trifolds, we have rack cards, and then we have all of this type of material. So if you want any of it, maybe you have a presentation, maybe you've got like a front desk where people would love some sanitizer pens and some vaccine card holders, let us know. Happy to drop some of those off to you. All right, so this is my contact information. If you need me, definitely email me, call me. That's our general number at the bottom there if you have consumers. Again, if you're thinking about, should I refer this consumer? Would they be able to help our consumer? Just shoot me an email. Happy to answer any questions that you have. Thank you.
Thank you so much, Sonia. Oh my goodness, what great information. We really appreciate all that y'all do. All right, so everybody take a deep breath. And Latosha Flood with, wait, I can't see my screen. Hope Center, I knew that. I just wanted to make sure I was saying the right thing. So Latosha, please go ahead, welcome, and thank you so much for being here to share with us about the Hope Center and what you're doing. So I'm going to turn it over to you.
Good morning, Kathy. Thank you so much. You're so sweet. I appreciate your kind words. Good morning, everyone. Thank you guys so much for having me today. In case you haven't had the opportunity to meet me yet, my name is Latosha Jenkins-Flood, and I am the Center Director here at the Hope Center with the City of Charleston. And I will be telling you a little bit more this morning about what our organization does. Next slide, please. So before I get into this slide, let me just give you a quick preview of what the Hope Center is. The Hope Center is a one-stop resource hub that was created in partnership with the Mayor's Commission to address homelessness, along with some other community partners. Mayor Tecklenburg is a strong proponent and advocate for our homeless, and he believed that having a one-stop resource center that provides comprehensive wraparound services is one of the things that are needed to address our issues of homelessness or our families or individuals at risk of being homeless. As a result of those efforts, the Hope Center came into fruition. We are currently located at 529 Meeting Street. We have opened to the public since June 6th, and that's about exactly 12 weeks. And to date, we have served exactly 106 individuals. And this presentation is going to show exactly what kind of services we have provided from June 6th up until yesterday. Next slide, please. So as it relates to gender, 56% of our clients are female, 44% of our clients are male. We also have non-binary and transgender options on our intake forms as well. If you want to go to the next slide, please. So the race of our Hope Center clients, we have 72% are African American, 20% are white, 4% identify as multiracial, and 4% are also Hispanic. Next slide, please. Charleston County is made up of 26.3% of Black residents and 69.6% of white residents. However, our data reflects that to date, the Hope Center has served about 72% of our clients, and the majority of that clientele consists of the African American race and 20% are white. Thank you. So the marital status of our clients, we have 52% that have never been married. We have 4% that are married. We have 4% that are widowed. We have 32% that are divorced, and we have 8% that are currently separated. Next slide, please. As it relates to client income, we have, and I'm sorry, Kathy, I'm looking at my slide and I got to slide my box down for just 1 second. We have 20% of our clients who earn less than $1,000 a month. We have 48% of our clients that have no source of income at all. We have about 24% that earn between $1,000 and $2,000 per month. And we have 2 clients that exceeded the $2,000 monthly income, but they would not be able to receive any government benefits such as SNAP or SSI. Next slide, please. The primary reasons for clients coming to the Hope Center, the number 1 reason is housing. The second reason is going to be rental and utility assistance. The third is going to be vital records. When we say vital records, we mean things such as driver's license, social security cards, birth certificates. The other need is furniture. And one need that I didn't mention was clothing, showers, and laundry services, and hot meals to eat. The top needs of those clients are 64% need clothing, 60% need laundry services, 56% needs food, and 48% needs access to showers. Other needs as reported to our clients are assistance with applying for SNAP and EBT benefits, employment, medical services, mental health services, substance abuse services, mail services, veteran services, child care, legal and domestic violence support, insurance enrollment, benefits assistance, education, and human trafficking support, along with phone services. Next slide, please. The process. So when the client enters into the center, we literally get clients that are living in encampments. And for those of you that are not familiar with encampments, encampments are different places throughout the Tri-County area. They can be under a bridge, they can be in an abandoned house, they can literally be in someone's car, or an old school where either one person or groups of homeless people live because they have no place else to go. We have families that are literally living out of their cars and they come to the center for assistance. We have clients who are couch surfing. For those that are not familiar with that term, couch surfing means you literally go from couch to couch of either a person that you know or you might not know in order to have a place to stay. We have people that unfortunately sleep in the parks and they try to sleep in public restrooms, et cetera, et cetera. So as the center is open, we encounter people that come from all of those different places. And one of the first things we do is because they're often tired. One of our clients mentioned to me yesterday, he said, Ms. Tasha, it's hard being homeless. You never get rest and you're always up because you have to sleep with one eye open and one eye closed because you're always at risk for being hurt by someone. And I thought about what he said and I couldn't even imagine having to not even be able to get a full night's sleep. So when they come into the center, one thing we want to do is we want to meet them where they are. We want to give them a hot cup of coffee, some orange juice, something to drink, give them an opportunity to sit down and get out of the elements, take a deep breath, get a hot shower, get some clean clothes on, and then meet with the case manager and sit down and figure out how we can assist those needs. So that's basically the process. After that, we work with our community partners to see how best we can serve our clients. One thing we're really diligent about here at the center is we want to make sure that no one falls through the cracks. One of the main things we hear from our homeless friends is that a lot of times people offer to help, but they never follow up to see if the help that they've given them actually works. So we're really diligent on making sure, hey, before I send you to agency A, hey, this is Tasha. I'm going to be sending Mr. So-and-so to you. Can I call you back in the next day or so to make sure that what he went there for, you were able to help him and what the outcome of it was, because that's so important. One of the reasons why the Hope Center works is we limit that process where clients have to go to a million different agencies to get assistance. The goal is to continue to have an ongoing, robust cast of partners that come to the center for designated time spaces and to provide the services so that our clients don't become overwhelmed with navigating that process. Next slide, please. So our outcomes to date, we have provided in connection with various service partners, emergency rental assistance, utility assistance. We've been successful in working with 180 Place and getting some of our chronically homeless men and women beds at the 180 Place shelter, along with some other private transitional housing throughout the Tri-County area. We have worked closely with DMH to provide mental health services. We have an ongoing support of great faith-based partners and for-profit businesses that have assisted us with a lot of clothing donation drives. And we've also partnered with them to assist with our food pantry. And we cannot do what we do here at the center without the help of our partners. So we just appreciate you guys so much, and we want to say thank you. It's really helpful to have such great partners. Next slide, please. So because we're still new, we're still in the process of finalizing MOUs. Those are memorandums of understanding for agencies that are going to come into the center. We have ongoing donation drives. We just concluded our clothing drive. We're now going to be working with some other organizations to get raincoats, umbrellas, belts, get them ready for the winter. And we're continuing to always look for different ways that we can partner with new and existing members of the community that we may or may not be aware of. And I believe that will conclude my presentation. Ms. Kathy, I appreciate you so much for giving me this opportunity, and thank you.
Oh, you are so welcome. Does anybody have any questions for Latosha? You can put them in the chat, and then we will try to address them. And Latosha's let us all know what you need. And where would someone bring clothing? Would they bring it to the center?
Yes, they can actually come to the center Monday through Wednesday from 9 to 5. We are closed on Thursdays because we treat it as an admin day. And on Fridays, we're open from 9 to 12. We're always accepting donations. We just ask that we get items that our friends, and I refer to our homeless clients as our friends, because I feel like sometimes the word homeless has a negative connotation. Our friends, we just always want to be mindful, and we provide them things that provide them a sense of pride and motivate them to want to go to that next level. So they're always appreciative of gently used items, and they especially love brand new items. And they love the opportunity to get gift cards and go to the store and purchase their own items, because it kind of sparks something inside of them that says, hey, I can do this. So we're always looking for donations, gently used. Believe it or not, we have a great need right now for men's pants, sizes 31s and 32s. I don't know what's so popular about that size, but that size goes so quick. We are currently located in Charleston County. I'm sorry, I'm trying to answer the questions in the chat as well, Kathy, and I'm trying to answer the chat questions and give my spiel too. Hold on, let me go back to the chat real quick. Okay, there we go. All right. A good number to call. I will give that to you in a second. We are located at 529 Meeting Street. We currently serve Charleston County, but honestly, we've had clients that come from Berkeley and Dorchester County, and we don't turn anyone away. So if you come here and you have a need, we will do our best to meet the need. We have people that have literally moved to Charleston for jobs and have become homeless, and they come here and we provide any assistance that we can. And if there's something that we can't do, we try to get you connected to the appropriate person.
That's
yes,
great.
I see that. TUW, yes, we had a wonderful time with the MUSC Data Quality Control Group on yesterday. They organized our clothing closet. They were amazing. And Kathy's wonderful staff actually helped to facilitate that. Devaney was my contact person. It was amazing. And we had such a great time. So thank you so much, guys, for that. Yes, it was so nice, Kathy. I was like, y'all gonna make me cry. This clothing closet is so nice. Because I was like, I'm gonna have to come on the weekends to get it done if I don't get help.
So, Latosha, maybe I'll get you to send us the information that people are asking and the information you just gave us about Monday through Wednesday, the donation days and that kind of thing, and we'll include it in the information we send.
Sure, that sounds good. Thank you, Kathy. And one other thing too, before I go, we have a newsletter that we create quarterly. I'm more than happy to get the second newsletter out to everyone. So if you're interested, I can share my email with Kathy, and then I can follow up with anyone that might be interested in receiving the latest copy of the Hope News.
Super. Okay, great. Thank you so much, Latosha.
Thank you, Ms. Kathy. I appreciate you.
And reach out to us if you need all of us in this network, if you have questions or need any help. So
yes, ma'am. Thank you.
Okay, thanks so much. All right. we've got lots of announcements today. And if we have time at the end, if you didn't let us know ahead of time you wanted to make one, then we will do our best to call on you. But I'm going to start with Angie Williams, has an update for the Americorps program. Angie, are you here?
Okay, hey, I'm here. Sorry, I ran for coffee really quick. Good morning, everyone. I hope you all are doing well. As Ms. Kathy said, my name is Angie Williams. I'm the Americorps Program Director here. And I just want to share the same news I've been sharing with you for months since over the summer. We are still looking to recruit for our Americorps program. So our next orientation is coming up October the 10th. It'll be 2 weeks. And we are still looking for about 5 positions. We have 2 more reduced full-time, so members serving at least 35 hours per week, and about 4 part-time positions that we're still looking for. Some really great agencies that the members will be working with. Benefits included for those members that sign up will be a living stipend, mileage reimbursement, some really good skill-based training for them to take on beyond their service year, and just some really good fun and a nice group of individuals that we're going to be with. So if you know anyone that is interested, please send them my contact information. They can email me or give me a call, and they can also visit our website, which is tuw.org/Americorps to learn more about the program. Thank you.
Hey, Kathy, you're
Kathy,
muted.
we can't hear you.
We can't hear you.
I am so sorry. And I said
now we hear you.
things about all of you and you missed it. So our next announcement is about the 2022 Community Health Survey. And I believe Debbie is going to tell you a little bit about this. This is a really important survey, so would love for all of you to participate. Debbie?
You've heard about the Community Health Needs Survey in earlier meetings, and they have extended the time period of collecting the data through the end of September. And the goal is to get 500 more responses in the Tri-County area. This survey is actually being done statewide this year. So it'll be great data, not only locally, but also across the state. So we have postcards that have the QR code on them if you have waiting rooms or areas that you would like to put them out, so people can just quickly use their phone and do the survey digitally. We also will provide you with paper copies if you want them for any of your clients. And we have them also in Spanish. The survey is available digitally in English and in Spanish, as well as in paper. So if you have any questions about it, feel free to let us know. And like I said, we can definitely get you postcards or serve paper copies if you need them.
Great. Thank you, Debbie. Appreciate it. This really is a very important survey. So I would encourage y'all to please share it with your clients or do the survey yourself. So thanks so much. All right. The Ryan White Wellness Center, Jamie Lee Morris. So Jamie was on earlier. Jamie, are you on?
Here. Yeah, I'm sorry. Okay. I'm sorry. I was in another meeting. Yes, okay. I'm Jamie. I'm one of the social workers from the Ryan White Wellness Center. We're an infectious disease sexual health clinic in West Ashley. We treat any kind of STDs coming in and off the streets, as well as HIV and AIDS. And we also provide PrEP, which prevents AIDS, HIV or AIDS, regardless of insurance or documentation status. But our big annual fundraiser is coming up, Art for Charity. It's our 12th annual celebration. So what we do is we partner up with Mitchell Hill, which is located down on King Street, and we get artists within the area to donate art, and we raffle it off. 100% of the proceeds go back to our program to help pay for stuff like medications, transportation to and from appointments. It's $5 to get in the door, and that automatically enters you in for a $200 Tanger Outlet gift card to use anywhere in Tanger Outlet. So that's coming up next week, and we would love to see everybody there.
Great. Thank you so much. That sounds like fun.
Thank you.
All righty. Jean Brooks with Trident Technical College.
Hello, everyone. I am actually filling in for my friend with SCDVA, Brennan Beck. They are hosting a career fair for military veterans, their family members, transitioning service members. All are welcome on September 21st, 2022 from 10 a.m. to 2 p.m. at Trident Technical College at the College Center in building 920. There will be about, I know the one flyer says about 50. I heard the other day it was about 70 employers. They're going to be doing headshots. They're doing resume writing. They're also going to have support services for veterans, not only for hiring that day. They're going to try to do a lot of the on-spot hiring that day, but they're also going to have services available, like the VA will be there and some other veteran support services. So there is also a online portion to the hiring event. If somebody cannot make it, all they have to do is scan to register on that first flyer, but it should be a great event in person, or if they can't attend, definitely do it virtually. So thank you for your time.
Great. Thank you, Jean. All right, Brenda Richardson.
Hi, good morning, everyone. Thank you, Kathy, for this opportunity. I just wanted to remind folks about the Veteran Stand Down. This is mainly hosted by the VA, and it's going to be on September 16th from 8 o'clock until 2 p.m. on that day. There'll be several vendors out there helping with the veterans and the homeless. So this is the first time they are able to have this since COVID. So, and the need is definitely there. So just wanted to spread that word out.
Great. And were you going to talk about the Vet Center tribute?
Yeah, we're actually, I'm preparing for it now. We're actually just doing a small tribute for 9/11. We have one of our veterans who was actually a survivor of that. So he's just going to talk briefly about his experience. It's from 11 until, I'm sorry, from 10 until 11:30. And then the following week, we will be celebrating the Air Force birthday. So anyone that's on the call that's the Air Force veteran, you're welcome to come by and get a free birthday cupcake. And we'll also have the VA Medical Center suicide prevention staff here as well to talk about the change of the number to 988, and also answer any other questions regarding for veterans and service members. So you all are welcome. Thank
Great.
you. Mm-hmm.
Thank you, Brenda. Okay, is Demita Holcomb on the call with Dorchester Children's Advocacy Center?
Yeah, I'm right here. Thank you, Debbie.
Great.
And thank you, Kathy. I just wanted to let you all know, I'm Demita Holcomb. I'm the grants director with the Dorchester Children's Advocacy Center. We're located downtown Summerville, South Carolina, and our facility provides pretty much a one-stop shop, so to speak, for child abuse victims and their families. Those victims will come here for the initial forensics interviews, which will turn over to our law enforcement partners to begin their investigation. And then the child services remains here in our facility where they receive mental health and trauma treatment. We are actually bringing in a internationally recognized child abuse expert, Victor Veith, who is with the Zero Abuse Project. He is coming into town November 16th to do a training with our multidisciplinary partners, including law enforcement, social services, those kind of agencies. But what we really want to let you all know, because I know we have a lot of faith leaders on this call, that Victor is actually going to be hosting we're going to host a breakfast at Bethany United Methodist Church in Somerville, and where Victor's going to be leading a discussion about the spiritual impact on child abuse. So that breakfast is open to any faith leaders in Dorchester and Berkeley County, and we would love to have any of you there, or if you work with any faith leaders within your agency, think that this would be beneficial for them. There's the contact information there, and we would love to have you.
Great. Thank you so much. All right. Let's see who's next. Sydney with My Sister's House.
Good morning. I hope everyone is having a great day so far. I just wanted to invite all of y'all to participate in our events in October. These events it's so important to have the community's support, and we couldn't do our work without your agencies and with you individually supporting us and furthering these efforts. We all have a role to play in addressing abuse in our community and responding to it. So these events give us different tools and knowledge to help us support survivors locally. Our town hall is educational in nature. We'll be hearing from survivors themselves, really learning from their experience, so that if we were a person who had been in their story, what was a way that we could respond and really help them? So we're going to reflect and learn from those survivors. That'll be at Wando Library. And it's free to attend. So we'd love to have you come out and just learn with us that morning from 10 to noon. Our advocacy luncheon will be downtown at the Harbor Club. It is a ticketed event. We'll also be hearing from a childhood survivor. Just a really great chance to learn and fundraise to support us. And then our 5 to Survive is a 5K run and 1 mile walk, honoring those lives impacted by domestic violence in our Tri-County area. So a family-friendly event. There'll be a kids run and just a chance to get out there, bring your friends and family, form a team. We would really love to have you. And again, your support means that we are continuing to provide life-saving services for the community. So we thank you for your engagement in any way. And if you have any questions, please reach out. You can see on the screen there, Hallie is overseeing our sponsorship information. She's our development director, and you can reach out to me if you have any other questions, or you can go to our website, mysistershouse.org. You'll see Speak Up South Carolina. That's our domestic violence campaign that we host each month, each October. And so that's where our event information is located, and we would love to have you.
Great. Thank you, Sydney. Yeah. All right. Madison Tinkle has an announcement about Charity Tracker. Madison, are you there?
Hi everyone. How are you? I hope you guys are having a good morning so far. Kathy briefly mentioned this in the beginning of the SafetyNet meeting about Charity Tracker. It is for free. So I have a couple of trainings coming up. One is on actually next Wednesday at 9 a.m. and the one 2 weeks after that on the 28th. It is for free. If you want to keep track of your clients, it's a great tool for you. But with all these announcements that I've been hearing, you can also post that in Charity Tracker as well, just as a bulletin board feature if you don't want to keep track of clients' information. But it's for free. And if you guys just want to join the bulletin, just email me and I can start the process with you guys. But I just want you guys to be aware of the upcoming trainings. If you guys have any volunteers or employees in our agency. Thank you, Kathy.
Thanks, Madison. So we've got time for a couple other announcements. Katie Reams with 2-on-1 had an announcement. And if you have an announcement, if you would put it in the chat, and I will do my best to call on you.
Thank you, Kathy. Good morning, everybody. A couple of quick announcements. The City of Charleston Housing Authority has 2 waiting lists opening this month. The first one is going to be for housing vouchers. That's going to open Wednesday, September 28th from noon to 1. And then 2 and 3 bedroom apartments are opening up. Wait lists for those on the 20th and 21st, respectively. They will open at very specific times. All of those applications are online only. So it's a great way for you guys to help your clients, is maybe to make laptops or iPads available to them on those days at those exact times. And it's important to know they have to have a working email to be able to complete those online applications. So that would need to be set up beforehand. They anticipate that those slots will fill up very quickly. So it's important to make sure that your clients are ready and able to start those applications exactly on the date and time that they open. And finally, 2022 Angel Tree signups. It's like Christmas time already. And so those signups are only in person this year, the 26th through October 7th. And we will send out, I've sent all these flyers to Debbie, so they'll be included with all the details of documentation requirements, times, dates, locations, etc., for that application process. So just want to make sure you're aware of all three of those things. Thank you.
Thank you, Katie. So Jan with the ARC of South Carolina. Jan, do you have an announcement?
Yes, thank you very much. So we're in Somerville since 1996, offering hope and relief to families dealing with Alzheimer's and related dementia. We have partnered with the YMCA here in Somerville for a health expo, a senior health and wellness expo, and it's going to be October the 13th. And it is being held at the ponds out at the big YMCA there. We're still looking for vendors. Some of you have already signed up, but we're still looking for vendors. And we'd also like for you to pass the word to caregivers. We had this expo before COVID and it was very successful. And so we're trying to get back out in the community to help the seniors. We're going to have free memory screenings, hearing screenings, vision, blood pressure check, diabetes. We're going to have nutrition seminars, and then lots of wonderful vendors there to help the seniors. So I'll put my phone number and email address in the chat. And if you would want to be a vendor, let me know, or if you can pass the word about the expo. It's from 10 to 2 on October 13th at the Y out at the ponds. So thank you. Thank you very much for giving me the time.
Sure. Thank you, Jan. Stephanie with Origin.
Hi, thank you, Kathy. I'm so glad to be able to speak to you all today because Origin has recently launched a new housing stability program. And what we're doing through that program is we are helping people who are having trouble with their rent, paying their rent, or facing possible foreclosure, and or need utility assistance resources in our community. And we aren't having a trouble getting clients to come into the pipeline to request assistance, but where we are struggling is, finding community resources that are available to these clients. And we're trying to be a liaison between the clients and their needs and the community resources that we have available to them. So my ask for this entire panel is, if you are aware of any community resources that could assist with that program, I would very much appreciate it if you wouldn't mind reaching out to me and sharing those resources with us so that we can pass them along to our coaches so that they can provide them to our community as needed. Thank you so much for your time. I'm going to put my contact information in the chat for everyone. And if anybody has anything that they could share with me, I would just greatly appreciate it. Thank you for your time.
Thank you, Mary. Let's see. Bernard with the ARC of the Low Country.
Yes, good morning to everyone. I just want to make you aware that we are having our first annual barbecue sauce tasting competition hosted at Firefly Distillery on the 24th of this month from 11 a.m. to 6 p.m. And we will be crowning the first South Carolina barbecue sauce champion. And the proceeds will all go toward the work that we do here in the Low Country. Thank you, and I hope to see you there. And you can check us out at Getting Saucy gettingsaucysc.com, and also on Facebook at gettingsaucysc.com. Thank you.
Thank you so much. Michelle McDonald, did you have an announcement?
Yeah, I just wanted to remind everybody, and thanks for having me, guys. Michelle with Dorchester Economic Development here, representing the Trident Workforce Development Board. We are having our Disability Expo and Job Fair on Tuesday from 10 to 1. So please share that information. I put the flyer in the chat, but if you could share that information with your consumers, we have several of you that have volunteered your time. We're going to have a resource table there as well. So thank you for that. And I will see you all out there.
Great. Thank you so much. Pro bono, Mary.
Yes, I was just gonna make an announcement that we do have 2 open positions. We have a legal assistant position open right now, and then also an intake coordinator position that's gonna be opening up soon.
Great. Thank you. Latoya.
Good morning, everybody. It's Latoya Lewis with the Berkeley Resource Connection Center here at Trident United Way. I wanted to share with you guys an event we're having this weekend in partnership with a couple of low country organizations called Parent Fest. Essentially, it's an event that we are having to empower parents and provide them resources for other agencies here in the low country. It's going to be this Saturday, the 17th of September, from 9 to 2 p.m. held at Royal Baptist. I've already attached the flyer in the chat. But if you guys are interested, it would be awesome, just to come out and connect with other families or send the information to your clients. There will be free childcare, and then some organizations will be presenting as well as food trucks in the area. So looking forward to seeing you there.
Thank you, Latoya. So we got I got time for 2 more. So Dave, you had an announcement about Heart Math tutoring. Oh, Dave must have had to drop off. How about Jenny with Hope's House?
Yes, I put in the chat. We are looking to hire a mental health counselor for our women's facility. So just if you know of anyone, have them contact me, and I put my email address in the chat.
Thank you, Jenny. And our last announcement from Ashley with Catholic Charities.
Sorry. Hi, I'm Ashley. I'm the client advocate from Catholic Charities. We're working on a couple projects. One of our biggest ones is a mobile shower unit. And we've heard earlier that showers are needed in the community. We just need a little bit of help of knowing where the homeless hotspots are. In those camps. Our mobile shower unit, we are going to try to be able to branch out to all 3 counties that we serve in the Tri-County area. And so we'd like to know which areas would be most beneficial to clients and most accessible to clients. So if you have any information about some of those hotspots or some areas where we can take that mobile shower unit once we're up and running, that would be great. And I can drop my email address and contact information in the chat.
Thank you, Ashley. That is great. What a great thing to have showers. Thank you so much. So I just want to thank you all. Our next meeting is Friday, October 7th at 9 o'clock. We hope you have a great week. If you're interested in making an announcement or presenting at any of our meetings, please contact me directly and we will figure out what works for you. But everybody take care of yourself so we can take care of the people that we serve. And thank you so much for all you do. And I hope you have a great weekend. Thank you.